Unfair to be critical of the healthcare system we've developed, because it was developed when we really didn't have the tools to identify who's at risk of what disease, to identify people at the earliest stages of their disease. And as a result, it operates very much to the right-hand side of the spectrum, with people with well-established late-stage disease presenting to the healthcare system. So, as Linda Stewart said in the discussion today, that's really, it's an illness system. It's a national sickness system, where in fact what you really want to do is, what we know is for every one of the big chronic diseases, and that's cardiovascular disease, stroke, diabetes, obesity, Alzheimer's disease, the major cancers, the major inflammatory diseases, what we know for sure is if you identify people early with those diseases and you treat them early, you flatten the morbidity curve. So people live a lot longer, much healthier if you can get in early. Cancer data is clear, the cardiovascular data is clear, it's been around for 20 years, but it's also true with all these other disorders. And so I think my passion at the moment is to say, how do you pivot a whole healthcare system to think much more upstream, to identify people at risk, intervene at people with early stage disease, use prevention tools to keep their risk of progressing with their disease much lower, and then flatten the morbidity curve to save money with late stage disease. And that, I think, is probably the only way this is going to be a viable exercise over time, because I think healthcare, with the changing demography, aging population, expansion of chronic diseases, you can't keep doing this. And interestingly, politicians and the NHS never really promoted prevention before COVID. So the NHS has never done prevention. They talk about it all the time. They never do it. It's been totally off the schedule. And politicians were much more interested in, we've got this new immunotherapy for people with late-stage metastatic cancer, blah, 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 blah. That whole dialogue has now changed. The narrative is now very much shifted. People saying, no. If we don't get these tools to diagnose people early, if we don't identify people at risk, the whole thing's going to go off a cliff. And I think it will go off a cliff. So I think that's why we need to be really focused on how do we make that shift now.